Which of the following visual defects is characteristic of a lesion in the optic chiasma? What is your answer? Answer is bitemporal hemianopia. Explanation: the optic chiasma is where fibers from the nasal retina, which corresponds to the temporal visual fields, cross. A lesion here leads to loss of the temporal visual fields, causing bitemporal hemianopia. This is often seen in conditions like pituitary adenomas or craniopharyngiomas. A patient presents with left homonymous hemianopia. Where is the most likely site of the lesion? What is the answer? The answer is option B, right optic tract. Right optic tract. Homonymous hemianopia refers to loss of the same visual field, either left or right, in both eyes. This occurs when the lesion affects post-chiasmal structures such as the optic tract or lateral genicular body, especially on the contralateral side. Which visual field defect is typically associated with a lesion in the temporal lobe affecting Meyer lobe? What is your answer? It's superior quadrant canopy. Okay. Explanation: Meyer's lobe in the temporal lobe carries inferior retinal fibers, which corresponds to the superior visual field. A lesion in this lobe leads to contralateral superior quadrantopia, also called pie in the sky defect. Which of the following conditions is most likely to cause a central scotoma? What is your answer? It's optic neuritis. Optic neuritis, often seen in multiple sclerosis, affects the optic nerve and can lead to central scotoma, characterized by loss of vision in the central visual field due to damage to muscular fibers. A stroke affecting the primary visual cortex in the occipital lobe would most likely result in birth defect. What is your answer? Answer is option B. That is homonymous hemianopia with macular sparing. Explanation: the occipital lobe houses the primary visual cortex. A lesion will lead to contralateral homonymous hemianopia, but in cases of ischemic stroke affecting the posterior cerebral artery, macular sparing occurs due to dual blood supply from the posterior and middle cerebral arteries. A patient presents with right inferior quadrant tanopia, which parts of the brain is most likely affected? What is your answer? Answer is left parietal lobe. Explanation. Inferior quadrant tanopia results from damage to superior retinal fibers which pass through the parietal lobe become reaching the visual before reaching the visual cortex because the left parietal lobe processes information from the right visual field. A lesson here causes right inferior quadrant tanopia. Which visual field defect is commonly associated with an anterior ischemic optic neuropathy? What is your answer? Answer is altitudinal hemianopia. Okay. Anterior is ischemic optic neuropathy. Often due to giant cell arteritis or hypertension after the optic nerve head and leads to altitudinal hemianopia where the upper or lower visual field is lost in one eye. Which visual field defect can be caused by lesion affecting the lateral geniculate nucleus? Monocular blindness, homonymous myopia, bitemporal myopia, central scotoma. What is your answer? Answer is option B, homonymous hemianopia. Now explanation. The lateral geniculate nucleus (LGN) in the thalamus relays visual information from the optic tract to the visual cortex. A lesion here disrupts input to both eyes, causing contralateral homonymous hemianopia. A patient reports sudden vision loss in one eye with a curtain-like progression. What is the most likely diagnosis? What is your answer? Okay, answer is retinal detachment. Explanation. Retinal detachment causes monocular vision loss with a descending or ascending curtain-like effects due to the separation of retina from underlying structures. Which lesion is likely responsible for a patient presenting with homonymous hemianopia with macular sparing? What is your answer? Answer is option B, occipital lobe infarct. Okay. Posterior cerebral artery infarct affecting the primary visual cortex leads to homonymous hemianopia. Macular sparing occurs because the macular region receives dual blood supply from both the posterior cerebral artery and the middle cerebral artery. Thank you.